Good morning, everybody. Welcome to another of our series of Stop. Good morning, everybody. Welcome to another of our series of breakfast briefings sponsored by Represent PA. We are the PAC in Pennsylvania, fully dedicated to supporting progressive women, Democratic women running for the state legislature. We want to flip both chambers with strong women. We did it this year with the House. We've got to secure a bigger majority in the House, and we've got our sights set on what we're going to do in the Senate in 2024. We've got some great speakers joining us this morning. Women's health care in Pennsylvania is not healthy. Maternal mortality is a crisis affecting every U.S. state, and Pennsylvania is among those. We have only 13 facilities in the entire Commonwealth of Pennsylvania that can provide surgical abortion care, and 87% of the counties in Pennsylvania do not have a single health clinic that provides abortion care. If you've driven across Pennsylvania, you understand how much area we have, and that's not acceptable. We also, Pennsylvania, did you know, has the 8th highest rate of opioid deaths in the country. Enabling quality healthcare will take focus. Our new House Health Committee has a Democratic majority, yay, and includes 6 represent-endorsed legislators who we know are going to be fighting on these issues. The Senate Health Committee is chaired by Art Haywood and has 3 women members, Senators Collett, Hwang, and today's guest, Senator Maria Collett, and they're all represent endorsed. So that will be a strong committee providing a voice. Unfortunately, they're a minority committee. And this is time for community groups, again, all across the Commonwealth of Pennsylvania, to advocate for change in legislation and to advocate for legislators who are willing to vote the difference. So what are we doing about that, and who's working on this? We are really pleased to have Senator Maria Collett on the call today. We endorsed Senator Collett in the 2018 election. We were early money for her. I had great conversations with her at the time, and we've been so proud to watch her work. Senator Collett was an attorney who decided she didn't want to work as an attorney and went to nursing school, and has an extensive healthcare background. We talk at Represent a lot about reflective democracy, and that means that we want different kinds of people from all walks of life, all backgrounds, all religions, all everything to be represented in our legislature, so we can hear the voices of all Pennsylvanians. One of the things that gave us great pride during the pandemic was that we helped to elect a trauma nurse, a nurse who understood what was going on medically. And she was a strong voice for making good decisions in the Senate, as strong as one could be in the minority, but she was a strong voice on what should happen. And people referred to Senator Collett to figure out what should be going on and what was going on in the pandemic. And we were proud to have been an early endorser of her work. Today, though, we've also got some special guests. Belinda Birnbaum is a doctor, and she's a co-founder of Physicians for Healthy Pennsylvania. She works right now in rheumatology. Dr. Lisa Goldstein is a child and adolescent psychiatrist, and she's part of the Physicians for Healthy Pennsylvania. Dr. Ann Steiner is recently retired as a clinical professor of OBGYN in the Philadelphia area. And in 2022, she helped to raise a good deal of money for Represent through bringing in doctors and other people. It was a fascinating event that was held at her home, and included Representative Morgan Cephas, who could talk well about what was going on in maternal mortality. And here we had a state legislator who's interested in making a change in this area, and an audience full of OBGYN and other doctors. And it was just a powerful evening. And we have Dr. Maura Dunfey-Hwang, who's a child and adolescent psychiatrist, who's also very much invested in this movement. So with that, I think we take it away to Dr. Birnbaum. Tell us about your organization. Why did you get started, and what are you doing for, what does advocacy look like in this space?
Thanks, Christine. Good morning, everybody. Thanks for having us. Unfortunately, I managed to delete my PowerPoint slides a few minutes before, so I am speaking a bit extemporaneously now, which is sometimes what we are forced to do. So Physicians for a Healthy Pennsylvania is doctors doing some grassroots activism that began this summer. What happened was we have an organization called Physician Women for Democratic Principles. It's an online action group of about 8,000 female physicians across the United States, formed in 2016 after Trump got elected into office. And we've been raising money for the past 7 years for candidates and causes that we believe in, everything from Joe Biden to the Sierra Club to Planned Parenthood to local candidates. With the Dobbs decision back in June, we started organizing by state, realizing how important these state elections were. And so we in Pennsylvania decided that we could no longer just be online. We needed to step out into the real world, use our physician voices, our trusted voices, our expertise. The timing was right. Between everything physicians had been through during COVID, from being these hailed heroes to these villainized doctors, from having these trusted voices to combating misinformation, and then to having our very jobs being threatened with criminalization. Our communities were at stake, our patients were at stake. We began to talk to each other about how we could organize in the community. And so we united with another grassroots group that was forming, Physicians for Shapiro. One of the first things we did was attend a rally with Josh Shapiro, standing literally behind him in City Hall. And what we started doing was discussing how we can gather ourselves. So we reached out to local state candidates, knowing how important these state elections were going to be, and volunteered ourselves, our expertise, our opinions, our narratives. We started doing town halls all over different counties in Pennsylvania. One of the first ones we did was for Gwen Stoltz up in Bucks County. We realized how important advocacy was, not just in the promoting the message that we wanted to do, but how important it was for us as physicians. We are burnt out, we are angry, we are frustrated, and that work of advocacy seemed to be the antidote to combating the moral injury that we were facing. And so the more we did, the more we wanted to do. And we decided that canvassing would be one of the important things that we did. When we take ourselves out of the exam room, we can still use our physician stories and our narratives. And it became a very powerful thing to knock on doors, not in our white coats, not with the power structure that we have in an exam room, and talk to constituents across mostly southeastern Pennsylvania, and have these very important conversations with them one-on-one about their views, and basically tell them, listen, this is what's at stake here in the election. The more we reached out to other doctors, the more others wanted to participate. And I will pull up at the end one of the letters that we did and circulated because other doctors started wanting to join us. So we canvassed and media started taking notice. We were featured in Vox, Axios, HuffPost. We were covered by media, not just locally, but nationally and internationally. And what we found is that we truly had this voice that we could use. And so what I want to do today is pass on to some of our physicians who are doing some of the important policy work so you could hear what they're saying, and also pass you on to Dr. Goldstein, Lisa Goldstein, who has been doing this for quite some time, and how we have come together you can hear our story. With that, I'm gonna turn you over to Dr. Steiner.
Hi, everybody. I'm so glad we're joined, first of all, this morning by Kitty Colbert, because some of the things I'm going to talk about may have legal implications, and she can address these a lot better than I can. So I'll jump right in. Health equity is the attainment of the highest level of health for all people. Studies in Pennsylvania have shown that there's more than a 10% difference in access to well child visits between Black and white infants. The life expectancy of a baby born in Pennsylvania is strongly tied to her zip code, to its zip code. A newborn in certain census tracts in North Philadelphia has a life expectancy of 63 years, while just a couple of miles to the south, the life expectancy may be 86 years. A recent study shows that the mortality among Black women is 2.6 times as much as the rate for white women during the 2021 COVID pandemic, and about 30% of maternal deaths were among Black women. Black people make up about 12% of live births in Pennsylvania. Challenges include access for mental health care, substance abuse disorders, lack of prenatal care, and low vaccination rates. Studies show that healthcare providers are more likely to overlook the concerns of Black patients. Starting in 2020, the Pennsylvania Department of Human Services created a number of initiatives to incentivize Pennsylvania managed care organizations to close this gap in care and outcomes. For instance, at the Penn Center for Advancing Maternal Health Equity, there's going to be a study looking at ongoing postpartum care and monitoring of a mother's health of mothers who have babies in the newborn intensive care unit, and they're going to incorporate doula care into prenatal care, delivery, and postpartum care. Maternal health desert, which is what Christine alluded to, is any county in the United States without a hospital for birth or birth center offering obstetric care and without any obstetric provider. As of 2020, there were 6 counties in Pennsylvania that were MCDs, maternal care deserts, and 13 with only moderate access. This deficit increases demands on areas that have maternity services. So for example, at Chester County Hospital, both new OB appointments and referrals for high-risk pregnancies have been delayed. Currently, abortions are legal in Pennsylvania through the 23rd week of pregnancy, and after that, if the life or health of the mother is in danger. But there are significant restrictions. Governor Shapiro has vowed to veto any legislation restricting abortion in any way. And our recent victory in winning the Pennsylvania House majority assures that there will not be anti-abortion constitutional amendment on the ballot this spring. And thank you, Represent PA, for that. Induced abortion in Pennsylvania requires 2 office visits at least 24 hours apart, except for medical emergency. 1 office visit is required for required only for medical abortion or the pill abortion, which is available up to 11 weeks. The required preliminary visit is for mandatory state-regulated counseling designed to discourage the patient from even having an abortion. And the second is for the procedure. So she must come twice and arrange childcare and lose time at work for those visits. This system is a source of great economic and social burden for the patient and adds additional risk by delaying the procedure. Federal funding due to the Hyde Amendment and state public funding will only cover abortion in Pennsylvania in the case of life endangerment for the mother, rape, or incest. Minors under the age of 18 can get abortions in Pennsylvania only with parental consent or court's approval through a judicial bypass, or if they are emancipated minors. And a minor can obtain contraception without parental consent, can consent to testing for pregnancy and medical and health services to treat pregnancy, including prenatal care and delivery, but cannot consent to abortion. In Pennsylvania in 2018, 32% of the population in our state was of reproductive age women. The Turnaway study showed that less than 10% of people desiring abortion, but who are unable to obtain an abortion, actually put their baby up for adoption. Participants who were denied an abortion were 4 times more likely to live under the federal poverty level, 3 times more likely to be unemployed. And children born because their parents couldn't get an abortion are more likely to live below the federal poverty level compared to children who were born later to parents who earlier had an abortion. Pennsylvania is now the closest abortion option for many people living out of state, especially in the western part of the state. And you know which states are the surrounding states. One center in Pittsburgh has seen a 60% increase in out-of-state patients since June 24th, the Dobbs decision, delaying appointments for these as well as in-state patients seeking abortion. There's a number of unexpected and potentially unexpected consequences of these post-Dobbs restrictive laws. For example, 44% of all OBGYN training programs are in states with or who have pending severe abortion restrictions or bans. All accredited residencies are required to train their residents in abortion care. So applicants for OBGYN residencies may consider these state restrictions not only for where they decide to train, but where they plan to reside and raise their families. And these decisions may affect overall women's healthcare access for years to come. So what are the current issues? Well, the outcome of the current trial in Texas regarding mifepristone, one of the 2 drugs used for medical abortion, may actually affect access to medical abortion throughout the United States. More than half of all abortions are medical abortions. Walgreens has stopped its distribution of mifepristone in some states where abortion is legal because the Republican Attorney General in those states objects to its distribution. And last Friday, Wyoming became the first state to ban all medical abortions effective July 1st, 2023. In Texas, 3 women have been sued by the ex-husband of a friend for allegedly helping her to obtain abortion medication. In Texas, 5 women have sued the state for denial of medically necessary abortions, and they were joined by 2 OBGYNs who say that widespread confusion among the medical community has left them unable to fully perform their jobs. So Senator Collett, here's our ask for you. We want you to provide state funds for abortion care coverage, including more clinics providing abortion care, travel, and childcare, and the expansion of insurance coverage. Please repeal restrictive laws, including the 2-visit counseling mandate, and allow medical abortion without an office visit, and get rid of the parental consent requirement. Expand requirements to allow physician assistants, nurse practitioners, and certified nurse midwives to provide abortion care and provide them with training. Require medical institutions refusing to provide abortion care to provide patients with complete alternative abortion information and access. Amend the Pennsylvania state constitution to explicitly protect abortion rights. Provide legal protection for abortion clinic staff and patients from harassment and violence. Restrict anti-abortion pregnancy crisis centers, which siphon off state allocated funding from maternal child care, and require that they provide full disclosure of the relevant services that they do and do not provide. Provide high quality child care and early childhood education, and support federal legislation, including the Women's Health Protection Act of 2022, which was voted down in the US Senate in February of 22. This bill would prohibit governmental restrictions on the provision of and access to abortion services. And we want to support the Equal Access to Abortion Coverage and Health Insurance Act, which would repeal the Hyde Amendment. And that's all we want from you.
Thanks, Dr. Steiner. And I think I just want to echo everything you said and really highlight that these asks of ours are really also, in addition to trying to help women, we're really trying to help what winds up being this very vulnerable patient population, these 2 visits necessary, the time off required, the demand on women to get the help they need. We're really trying to make that easier. And we think that women are more primed to support women. And so we want to emphasize that. I'm going to turn this over to Dr. Dunfey-Hwang, who's going to talk about a lot of the work she's been doing, both as a pediatrician and a psychiatrist. Go ahead, take it away, Maura.
Thank you. And I want to just say in the beginning that my youngest daughter is being picked up to go to school at 8:55, so I may need to pause, but we'll see how that goes. Sorry, I'm going to share my screen. And I think so much of what Dr. Steiner talked about fits in with what I will talk about as well. And so what Dr. Birnbaum said in the beginning and sort of how we all came together really organically has been exciting, I think is a fair word to use. And I want to just also acknowledge the women who have been doing a lot of this work in advocacy for years. And so our excitement over the last several years, I think we have a real opportunity to work with like our professional medical organizations. So I have just within the past couple of years, actually just 1 year ago, I'm now on the board of the Delaware County Medical Society. I wasn't, I've always sort of been peripherally, I would say, involved in organized medicine. And it became clear that, the way that things are going to happen was being involved in these exact conversations that we're having today. So to kind of go off what Dr. Steiner had said last October, many of you are probably aware, the Pennsylvania Medical Society at long last they took a position on abortion where their previous position had been that they had no policy. And so this is opposing any criminalization of a physician or a healthcare provider who performs that service or a patient who seeks that service. So I'm going to zoom us out a little bit back into the weeds and help you I'm going to rely then on Dr. Goldstein to bring us back out. But in terms of looking, what can we learn from history? And before I attended medical school, I worked in the division of trauma, actually doing gun violence prevention and that research. And so public health and systems thinking. And then as a psychiatrist, I studied family systems. And so systems thinking is sort of where I have come from. So this is going way back to 1909. William Penn here, anticipating filtered water supply coming, is spraying the devil, I guess is what it is. And the suitcase has germs of typhoid, diphtheria, and scarlet fever. And so the public health and the systems approach for all of those pathogens previously wasn't just what do we tell people to do, it was let's treat the water. And so if we use that same idea with airborne illness such as COVID-19, we want to be looking at the individual behavior level, but we also want to be treating the air, and that's the real systems thinking public health approach. And so one of the ways that, again, I think this is exciting, early on in the pandemic, a civil and environmental engineer got together with someone who had been in the air filtration business for his career, and they made an air filter. And these air filters have been used in schools. Could be called the Corsi Rosenthal box. It's been used in schools, in churches, in homes and buildings. It reduces the viral load of COVID-19, but also smoke from wildfires. It's helpful for kids with asthma, things like that. So there are, and I think that they're there. So I am going to, she's coming in. There are applications for us to think about this in Pennsylvania. So one of the exciting things we've been able to do is have conversations with the Pennsylvania Department of Health and then Department of Education, Intergovernmental Affairs, to talk about how could we use these Corsi Rosenthal boxes to keep our schools healthier. The air, there are a lot of schools that are old and deal with asbestos and things like that. And so an idea was a statewide competition in schools where we would be working with local public health departments, school districts, and then importantly, the community, and making sure that we, as physicians, we're members of the community, we are, so using both of those voices. I'm going to talk a little bit about mental health, but
we're going to ask you to talk about mental health, and then we'll turn it over to Dr. Goldstein.
Yep, and I'm going to make sure, actually, I'm going to turn it over to Lisa early,
okay,
because I need to go get my daughter out the door. Sorry.
All right, so Lisa, you ready to take it away?
Lisa, does that work for you?
Lisa, you're
Lisa, you're
likely
on mute.
muted.
Unshare your screen, Maura, for a bit. Share it when you come back. Oh, Maura walked away. Okay,
I'm right here.
there you
I'm
go.
right here. Yep.
There you go. Good morning, everybody. I'm Lisa Goldstein. I come at this from a different perspective. I've been involved in Democratic grassroots volunteering activism for a long time, but I'm part of that wave of women who got really involved following the 2016 tragedy and co-founded an Indivisible group, Indivisible Mainline South. And you all don't realize how incredibly lucky you are this morning and how different this is, that you have 4 women physicians on this call that are identifying themselves as women physicians, as physicians. Doctors don't do that. We don't get involved in politics and say, hey, I'm a doctor, I'm knocking on your door, I'm doing a TV interview or a radio interview. That is new, and that's happened since the Dobbs decision. Now, Ann and Belinda and Maura, they've been out there doing incredible things, starting organizations, advocating for the issues, the women's health issues and the health issues that are important to them. But this is what's happened in the last year is different. Now physicians are organizing like as grassroots activists to help candidates get elected. Ann hosting that event for Represent PA. And at the end, we'll show you some photos of physicians in a parking garage and on my driveway, getting ready to go out door to door for candidates like you, Senator Collett. So, you know, in many ways, I've been incredibly lucky since the Dobbs decision, because even though I've been doing this from my home and with an Indivisible group, now I get to do this with other doctors. So now, Maura, I'm going to quickly give you an idea. For me, healthcare is not about a single issue. Almost every issue is related to women's healthcare because most of us on this call are women. And what you all know is we're responsible for the healthcare of not just of ourselves or other women, but for our families and our communities. So for me, healthcare is about electing Democrats. There is only one, the slide before, the picture before, Maura, right before that. There is only one party that supports democracy. And the only way we will take care of the health of individuals in our communities is if we elect Democrats. So what we've learned over the last 6 years is that if we depend on the party and the candidates, no offense, Senator Collett, to reach out to voters themselves, it's expensive and it's inefficient. It's not how we build democratic infrastructure by letting the campaigns do it all. It's not how we build our democratic community. And the data, the volunteer, the enthusiasm all gets lost at the end of every campaign. So next slide. Instead, what's really taking the grassroots community by storm is this idea of relational organizing or deep canvassing. And so what I'm going to encourage each of you to do today is to do exactly what strong committees, strong grassroots organizers, and people like us have always done. Talk to the people you know. It is not a bad thing to talk about politics. It's not politically incorrect for a physician to come out and say, as a physician, I support this candidate or this issue. And we have to, for those of us that are committee people and party members, we have to get out of our party bubble. And next slide. And I walk the walk. And fortunately now I walk the walk with my fellow physicians. So I'm in the bottom there with my hands on my hips in my democracy garage. You can see democracy written over the garage. And in the blue dress and black sweater, that's Senator Scanlon in front there. That's my garage. That's my driveway with all those people listening to whichever candidate we're canvassing for that day. And in the bottom on that rainy day in the parking garage, you'll see our Speaker of the House, Joanna McClinton, Senator Congresswoman Scanlon is there, several state House reps. and a bunch of us women physicians, we were out going door to door. At my democracy garage, if you wanted, you could pick up a democracy box. Everything you need could be in that, is in that box. To host a canvassing event, to begin to connect with your own neighbors. We have neighborhood leader programs. There are so many ways out there for every person on this call to do what you do best, do things you're comfortable with, but take the next step beyond raising money. No offense, Christine, raising money is incredibly important, but we all have ways we can contribute. And so whether it's for Senator Collett or your next candidate, I'm always happy to answer questions. And there's just, the physicians have been amazing this year. So I'm lucky to be here on the call with all of them and with all of you. Thank you.
Dr. Goldstein, I gotta say, it's not an or thing. I don't mind you talking about organizing. It's an and thing. You need to do this and that.
Yep.
And then I'm going to quickly share my screen just to end it up and show you one of the things that we are most proud of. Hang on. Whoops. Uh-oh. Let's see where we went here. Sorry, guys. This is move this over. Can you see the Physicians for Healthy Pennsylvania website? One of the biggest things that we did, we, again, physicians being apolitical is something we can no longer afford to do. We are no longer representing our institutions. We are representing ourselves, which is something that we always feared in terms of our institutions not being happy with us. And I just want to leave you with one of the letters that we wrote, which I think encompasses all the values that we want. This is an unprecedented time in that we're not stepping out to defend a cause or even a candidate, but physicians this past election cycle stepped out to represent an entire party, like Lisa said. The Republican Party, as we know it, has abandoned science and truth, and we were uniting behind, and we will continue to unite behind an entire political party because we need to protect our patients, our families, and our collective communities. And we need to continue to work to elect Democrats because the way we see it, it is not only the morally correct thing to do, but it is vital to the health of Pennsylvania. Rudolph Virchow, a renowned physician and philosopher, said that politics is just medicine on a larger scale. It is a social science. And so we shall continue to work to promote that social science because we came dangerously close to an abortion ban this past election, and we will continue to work with wonderful organizations like Represent PA to get the people we need in office to do what we need to do to protect our patients and our jobs and our communities. And with that, I think we will turn it over to our represented official that's here today, Senator Collett.
And thank you very much. I'll cut in first, Dr. Birnbaum. Thank you to our physicians. We'll get some questions to you later, I am sure. And I love the way you talked about, and particularly Dr. Dunfey-Hwang talked about systems thinking. Being an engineer and a former executive managing various kinds of manufacturing facilities, I think in systems thinking. And I think it's, and that's my comment earlier what to Dr. Goldstein, it's an and thing. We need to look at everything and for many years, people thought that if they just lobbied, it would be okay, but you're lobbying people who aren't hearing you. And so that's why we decided we needed to help change the players. And so one of the people who we helped to elect is Senator Maria Collett. So Senator Collett, you got a lot of asks for you today. You gonna go get them all done?
I hope so. And I really want to say thank you to the doctors that were on the call today, and especially to Dr. Steiner for that very clear list of asks. I had prepared some slides this morning, but I don't think that they're really necessarily relevant to our discussion. It was really about how do we keep healthcare providers here in Pennsylvania. But I want to touch on some of the issues that were raised by Dr. Birnbaum and Dr. Goldstein and Dr. Steiner and Dr. Dunfey-Hwang, and talk about what we are doing in the legislature that impacts the things that we have been discussing and hearing about this morning. I want to start by letting you know sort of the lay of the land. We know that in the Pennsylvania State House, we have a majority thanks in large part to Represent and organizations like Represent, and also to the deep canvassing efforts that the House Democratic Campaign Committee started a year before that 2022 election. They started those deep canvassing efforts to find out in every community across the Commonwealth that they targeted, what are the issues that are important to voters? And then they made sure that the candidates that they had on the ballot were speaking to those issues truthfully and with integrity, so that when they got to the House, they were able to live up to the bargains that they made with voters there. So those deep canvassing efforts are absolutely integral to making sure that we get to a majority in our state Senate as well. We are at 22 members, Democratic members in the state Senate. So we are operating with a minority, 22 to 28 Republicans in our state Senate. But with our House majority and with our wonderful Democratic Governor, Josh Shapiro, I think we're going to have an opportunity to put some real pressure on the Republicans in the state Senate to get some things done. They're not going to be able to hide behind the House anymore. That's what they've done for years. So in addition to that majority, I want to let you know there are 3 nurses, RNs, elected to our state House and 1 doctor. So we have some medical professionals in our state House. And in our state Senate, we have 2 nurses, myself and Judy Ward, who is she's the majority chair of the Aging and Youth Committee, where I serve as the minority chair. So we do have some healthcare professionals. So hopefully we'll be able to get those voices really elevated, or at least the voices of healthcare professionals that are supporting access to healthcare across our Commonwealth. So I wanted to start by letting you know that. I also wanted to tell you that I am serving on the Health and Human Services Committee in the state Senate for the first time. And I'm really thrilled to be on that committee. You heard Christine talk about Art Haywood as our minority chair. Our majority chair is Michelle Brooks, and she represents a rural part of Pennsylvania, and she is a huge advocate for rural health. So that's one of the ways that we're going to start talking to her about women's healthcare and making sure that we have access to healthcare across the Commonwealth, by really hammering home what it's going to do to rural patients if we start enacting laws like the Idaho law. All of us heard about the Idaho hospital that's no longer going to do any births in their hospital because of the restrictive laws and the threat of criminalization against doctors. And that means that patients there are going to need to drive 46 miles to get maternal health. We know, all of us here on this call, that that's absolutely absurd, that when you enact laws that have those kinds of impacts, that what you're doing is hurting the people in your state. You're not doing anything that's really going to have a positive impact on birth rates, maternal mortality, and maternal and women's health. So we've got to really hammer home that that rural healthcare divide is going to impact rural patients and rural residents. We have got to do that. So that's one of the things I really wanted to talk about here. We also heard about mental health, and I want to talk about that. I want to talk about Governor Shapiro's budget and how he has pledged in his budget address, the proposal that he offered us, to make sure that insurance companies are operating with parity when it comes to mental health and physical health. This has been a huge deficit here in the Commonwealth. So I am very supportive of those endeavors. And I think that we can actually make sure that we are holding insurers accountable for providing that mental health care on par with the way that we're doing with physical health care. When you break your leg and you go to the emergency room, there's no question that you're going to need surgery to fix that break and a cast to help you rehabilitate, to make sure that you are back up to your full physical health prior to the break. For some reason, we're not holding insurers accountable when it comes to mental health. And so we've got to do that. I am thrilled to hear Governor Shapiro say that he's going to hold insurers accountable for that. One of the other things that goes along with mental health is that $100 million that Governor Wolf in the prior budget allocated for the Adult Behavioral Health Commission. I had the opportunity to serve on that commission. We did an incredible amount of work in just 17 and a half hours of hearings to prepare a report, submit it to the legislature with recommendations on how we think that $100 million can go to help counties and providers with mental health needs in our communities. The legislature is sitting on that money. The money has been allocated, the report and recommendations have been made, and the legislature is not moving the legislation that would require us to give that money out to the places where it can do the most impact. So for those of you that are interested in making phone calls, sending emails, writing letters, please, please tell your legislators, let's let loose that $100 million that has already been allocated for use in the mental health space across our Commonwealth. I'm thrilled to announce that there are companion bills in the House and the Senate that would require consent for patients under anesthesia who are getting pelvic and rectal exams in hospitals without consent. And we are really excited that the House Health and Human Services Committee is going to hear that bill towards the end of the month. We're hoping that it'll come over from the House to the Senate, and we'll get a chance to get that to the governor's desk so that we can really have an opportunity to give people the opportunity to consent before they have a pelvic or rectal exam while they're under anesthesia. And then the final thing I wanted to talk about are actually two things: crisis centers, those anti-abortion crisis centers. There is legislation that has been introduced by my wonderful colleague, Senator Amanda Cappelletti, to make sure that we are not funding those. As you may or may not know, there is an existing line item in the budget that has been passed year over year to give millions of dollars to these anti-abortion crisis centers. And it's sort of like this hidden little part of the fiscal code. And every year it just sort of goes on and on and on. And I can tell you more and more of us in the state legislature are paying attention and saying, wait a minute, I'm not going to vote for a fiscal code that's giving money to these crisis centers. So we are really taking a stand on that. And I am very hopeful that Governor Shapiro is going to make sure that that's not happening in our state anymore, not going through our budget process. And then finally, I wanted to touch on exploring legislation that's going to protect physicians in Pennsylvania, providers in Pennsylvania who are providing abortion care that's legal in Pennsylvania to patients in other states. We are in the works to introduce legislation that's going to mirror the legislation that's recently been introduced in California that would make sure that that law enforcement personnel would not comply with subpoenas for providers here in Pennsylvania that are providing abortion care that's legal here. So that includes telemedicine, that includes medication abortions. If you're providing that in another state, we are going to make sure that here in Pennsylvania, you cannot be dragged to another state for criminalization there. There are a lot of bills that are really in the works here to make sure that we're addressing those issues. Representative Howard in the State House has a comprehensive rewrite of the Abortion Control Act that's going to move the entire section and its updates from the criminal code where it sits now. Yes, abortion is safe and legal here in Pennsylvania, but it sits in the criminal code. We're going to move that. We're going to move it to the public safety code so that we can make sure that we are explicitly allowing reproductive health care services to be offered here in our Commonwealth. So we are working on the ask that Dr. Steiner presented. As we know, in the legislature, things move slowly, but I want to point out that, what Dr. Goldstein and Dr. Birnbaum said is absolutely true, that for 24 of the last 27 years, Republicans have been in charge of our state house, and for 29 years straight, they have been in charge of our state Senate. And what I can tell you is that when we see in action, when we see gridlock, when we see our Republican counterparts more interested in passing road naming bills than bills that are actually going to help people in our Commonwealth, that's where we point. We point to those majorities and we say, these are the people that have been holding hostage the people of Pennsylvania for decades. 30 years in our state Senate. We are working toward a majority so that we can meet our colleagues in the House and our wonderful governor and say, it's time to do some good things in Pennsylvania. So thank you. I know there are a lot of questions popping up in the chat box, and I want to make sure that we have a chance to address as many of them as we can. But thank you so much. Thanks for letting me be here with you all today.
Senator Collett, you always amaze me how you listen very carefully and you're able to respond. When Dr. Birnbaum and I talked about this, I told her we were going to have you on because would you like to talk about threats? Do you want to talk about the threats to mifepristone in PA or?
I think
Yeah.
before we do, Christine, there is, again, someone had to get their child on a school bus.
Right.
There is one other issue near and dear to us that if we can just have a minute for Maura to
Okay,
bring
no
up real
problem.
quick. Go ahead. Maura, are you there?
I see the slide, but we don't hear Maura.
Sorry, I'm back. My daughter got off to school, so we're all good. I had talked a bit about public health, and I wanted to just sort of some of the work that we have done is also bringing diversity, equity, inclusion, and belonging lens to all of the work we've been doing. And obviously part of my bias as a child psychiatrist is mental health, but that mental health really touches on all of the things that we have talked about today. In terms of mental health and then firearm violence, so whether that is actually homicide or suicide, there are certain things and opportunities I think that we also have right now. And so as far as gun violence goes, there is, my understanding is that there is a bill in the Senate that is for the Extreme Risk Protection Order, or ERPOs, and these would help protect communities from firearm suicide, which outnumber firearm homicides and is a really important part of any discussion whenever we're talking about gun legislation, to make sure that suicide is part of that conversation. And then the other couple of things, child access prevention or safe storage legislation, permit to purchase has a lot of very good evidence. And so being able to have discussions about that, include that in the discussion when we're talking about firearm legislation. And then for mental health, I just wanted to talk about, kind of come back to collaboration, which is, there are collaborative care models, again, which are evidence-based, to be able to work with primary care and mental health and increase the collaboration there. Telemedicine is an important part of that, and an important part of access to both mental health care, as well as giving primary care physicians and or providers the opportunity to see their patients and be able to address the mental health needs. And then finally, structured literacy programs and the science of reading is another opportunity to address literacy early on, and that is just building healthier kids. So I did want to get to another place for action steps, and thank you for your patience with that.
Well, thank you. So there was a question, why do we have the pleasure of having Kitty Colbert on the call. Kitty, as many of you know, is a strong legal advocate for change. She had argued Planned Parenthood v. Casey at the Supreme Court. She is been somebody we've consulted periodically. So Kitty, do you want to comment on the what's going on in general in mifepristone and the abortion drugs and how that hits Pennsylvania?
Sure. So the mifepristone case is in Texas, but a very conservative anti-abortion judge is ruling on it, and the Fifth Circuit, where the ruling would be appealed, is equally as bad. So it is possible and probably likely that this court will make a ruling that the approval of mifepristone by the FDA 20 years ago, boggles the mind that he could do this, was inappropriate. And then the question then becomes, will he issue a nationwide injunction? The likelihood is probably yes. And that will affect mifepristone in all 50 states, despite its effectiveness as a drug, and one that, when paired with misoprostol, is the safest way to do a medication abortion. So that will affect the entire country. The doctors here in the state will be probably unable to get mifepristone except through pharmacies in India or other countries that have approved it, but that risks a variety of raises a variety of questions for individual doctors. And so I think what will happen in the state is not only will we see fewer medication abortions, but those that are done will be done through misoprostol alone. And while it's safe, it's not as effective as the two drugs together. And trust me, the same group that brought this case against mifepristone will come back and bring a second case against misoprostol. And I think that is the bottom line, is that our opponents are relentless. They don't stop. They're creative. They try every means necessary to interfere with reproductive freedoms across the nation, and that affects people in Pennsylvania. And I can't say enough for all of the docs who are out there advocating on our behalf, and Senator Collett and other members of the House and Senate who are really working hard to maximize our freedoms. And Senator Collett, let me just echo, I started the practice of law with a case against crisis pregnancy centers. So happy that you are working on that. Let's talk. I have some ideas about other ways to do it besides legislation, and go for it. It's great.
You know, we're exceedingly lucky here in Pennsylvania to have advocates like this that we can call on, like Kitty Colbert. And, you know, I'm so impressed with the work of the physicians. I met Belinda through Dr. Ann Steiner, and we agreed that we do this presentation, and I have found it very, I learned a lot. And I always like things where I learn a lot, but it also fires me up personally to do this work. So we're running out of time and we're getting close to 8:30, but I want to thank our physicians. I want to thank you so much. I want to, Senator Collett, as I said, you always wow me. And I so want to put you in the majority on these committees that we need to get there. And okay, so let's go to my final slides, Tiffany. How are we going to get there? You know, we've talked a lot about our campaign investment strategy, and we invested $700,000 last time. And you can look around at the list of the women in the legislature and the Democrats, and we've supported almost all of them. But we're building the war chest now to raise money for 2024. By the way, today there was an article, Spotlight put out yet another article about the problems that women face in the legislature. And they talked about money being an issue, and they cited the work of Represent as having been so important to making a difference in the legislature. But, you know, 2023 is not an off year for us. 2023 is not an off year. The House majority is too slim. We have 2 open seats today. In the 163rd, which was the Mike Zabel seat, we are getting ready to endorse the woman who's been proposed by Delaware County to run in that seat. As Senator Collett mentioned, we have 22 Dems and 28 Republicans. We have 3 seats that we consider the most flippable, but these will be expensive. There will be a lot of out-of-state money coming in once again to support the Republicans, and we want to be out there in front and have the money for early support. And we want to be able to go and say, hey, Democrats, if you put in and if you support strong women, will be early more money in those races, which should count. Our goal, you know, by the way, this is Women's History Month. We believe in it. And since our goal is a Democratic majority in Harrisburg, we did well in Joanna McClinton was a 2015 special election endorsee of ours, and look where she is now. Women make up over 30% of the legislature, but we're not finished. And one of the ways that we can go about this is we have a very generous donor who is matching anybody who's a brand new contribution. If you've never given to us before and you invest in us in March, she will match this. Of course, it's a she will match this funding. If you've been, let's say, a $200 a month donor before and you raise it to $400 a month, she'll match the extra $200 a month for the next year. So this is but it's only good until March 31st. So we have 8 more days for you to give, and give generously to help us build up our war chest. And of course, we always need volunteers. So one of the things that somebody put in our chat, which is so important, is I get very frustrated when I'm talking about our work casually. I talk to everybody who I'm sitting next to in the bus about represent, and people say, how come I don't know about you? And I find that frustrating. And you can help. You can talk about whatever you're going about your regular work today, talk to your friends. Say, I just sat in on the best call and there are future calls coming up. You got to know about Represent PA because they are supporting women who will make a change for all of us in Pennsylvania. Our next event is not on this list, but it will be April 4th. We're going to be talking about the environment in Pennsylvania, all these things. You read an article and you hear about whether it's the train derailment in Ohio that affects residents of Pennsylvania, or discussion about RGGI and greenhouse gas initiatives, or fracking and the water or the oil pipelines and whether they leak. All of these issues are out there. We're going to have Katie Bloom from Conservation PA is going to come in and talk about how she sees the environment in Pennsylvania, what the issues are. And she's going to be joined by two brand new state reps who we helped elect, Mandy Steele from Allegheny County and Tara Probst from Stroudsburg in the Poconos. And they're going to talk about, hey, they came in thinking they're going to affect the environment and work hard on this. What are they working on together and how are they supporting the environmental cause? So we're continuing, watch for that invitation soon. We're continuing to do the work in Pennsylvania. We're continuing to think about how we do better, and we need your help. And again, thank you very much to our speakers. Thank you.